Okay, so the last thing that we need to cover are some various bone disorders. So if we have any type of bone disorder, it's basically representing an imbalance between how much bone we're depositing and that of what we're reabsorbing. So that balance is affected in pretty much all of these bone diseases, or at least the major ones. So we're going to talk about these three below. So we have osteomalacia and we have rickets. They're basically the same thing, but rickets is what we call it if we're referring to children. So, osteomalacia is basically a group of disorders in which our bones are poorly mineralized. So our osteoids produced, but those calcium salts are not adequately deposited. And because we don't have the hard calcium salts there, we actually get some soft and some weak bones. And sometimes this can be painful if we're bearing a lot of weight on it. And again, osteomalacia, rickets is the same thing as osteomalacia, but now we're talking about in a child. It's more severe in a child if we're talking about rickets because our bones are still growing rapidly. So because they're still growing rapidly and we don't have these calcium salts, the children can get or typically get bowed legs and other bone deformities because their bone ends are enlarged and they're not and abnormally long. What is the cause of osteomalacia and rickets? Vitamin D deficiency or insufficient dietary calcium or both. So don't forget, like, even if we're getting a ton of calcium, if we don't have vitamin D to absorb it in our intestines, we can't actually use any of the calcium we're ingesting at all. Other things can contribute to osteomalacia and rickets, like if you're a smoker, that would increase your chances of having osteomalacia. If you are not getting enough stresses on your bone, we talked about that. For example, if you're bedridden, some hormonal conditions and genetics can also play a role. Osteoporosis is different from osteomalacia. This is a group of diseases in which our bone reabsorption is going to exceed our bone deposition. So our osteoclasts are working at a higher activity than our osteoblasts. Typically, the matrix remains normal, but our bone mass as a whole declines. So again, if we have lower bone mass, then we are more apt to having fractures, especially in a vertebral column or a hip. So some treatments for osteoporosis, because it is pretty prevalent, um, is calcium supplements, vitamin D supplements. Of course, we need those. Doing weight-bearing exercises if it's caused by the lack of weight-bearing applications to your bones. Some hormone replacement therapy, they've had some success with it, slows the bone loss, but we can't reverse it or go back and rebuild bone. It's pretty controversial, so I'm not super worried about hormone replacement because if you decide to go the route of hormone replacement, it does increase your risk of heart attack, stroke, and breast cancer. So I'm not sure that the benefits outweigh the cost. Um, some other drugs that are also questionable or still in trial for osteoporosis are biphosphonates. They help decrease osteoactivity, so we're not breaking down our bone as much. Don't worry about these drugs. I'm not really going to ask you on these drugs. The last type of disease I want to talk about is Paget's disease. And basically, what's happening here is that we get bone deposition and bone reabsorption, but it's haphazard. Like it's randomly going in and breaking down the bone and randomly adding bone to various places. So basically, what happens is for our bones to grow really fast and they're not going to develop as they should. So they're going to be developed poorly. We have way more spongy bone to compact bone and reduced mineralization, so our bones are weaker. Rarely occurs before the age of 40, and most of the time, people don't even know they have this unless for some reason they go to the doctor and they get an x-ray. And that's when they can tell they have this. They don't even know what causes it. They think it's a virus. They don't even know what type of virus. Um, what are the treatments? Calcitonin. We talked about its function as an antagonist to the parathyroid hormone and some other drugs, but I'm not really worried about treatment unless it's calcium or vitamin D. So this is what normal bone, if we're talking about our coxal bones or our hip bones, look like. In somebody with Paget's disease, we can see we have bone breakdown and reabsorption in random places, and then we're building bone in other various places where we shouldn't.